नमस्ते बेटी, हमेशा खुश रहो बेटी। A very good morning to you all. Myself, Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science of JAYOTI VIDYAPEETH University. In today's chapter, we will be continuing with the introduction part of the elementary track. In today's lecture, we will be discussing about the different differential diagnosis of the cases of dyspepsia and vomiting. We will be studying very brief about these two topics, and then we will be discussing about the various conditions in which these two symptoms are present. Dyspepsia and vomiting are not diagnoses. Always remember, these are the clinical symptoms which are present due to many factors or in many diseases. So we will be discussing about the management part because the management will be dependent on the disease condition. But we will be discussing the different causes of these two unique conditions and causes in which these two can be seen one by one. So this is the anatomy, as we have discussed in the previous lecture. That we have the alimentary tract, the mouth, tongue, we have esophagus, stomach, liver, gallbladder, intestines, small intestine, large intestine, we have rectum, anus. So this is the anatomy. Now we start with the dyspepsia. What is dyspepsia? In the last lecture, we have discussed about dysphagia. In today's lecture, we will be discussing about dyspepsia and so dyspepsia is a term that is used to describe symptoms such as bloating and nausea. So if a patient comes to you and he says that there is bloating and nausea, that means he's having dyspepsia, although dyspepsia is not the clinical diagnosis. Which are thought to originate from the upper gastrointestinal tract. So dyspepsia is the term that is used to describe symptoms such as bloating and nausea, which are thought to originate from the upper GIT tract. Dyspepsia is also known as indigestion. So this is also known as indigestion. It is a term that describes discomfort or pain in the upper abdomen. So there is discomfort or pain in the upper abdomen. It is not a disease. So dyspepsia is not basically a disease. It is a term refers to the group of symptoms that often include bloating, discomfort, nausea, and burping. So this is a condition and it includes bloating, discomfort, nausea, and burping. Now, what are the different causes for dyspepsia? Dyspepsia causes are upper GI disorders. Various upper gastrointestinal disorders are responsible for the development of dyspepsia, like peptic ulcer disease (PUD). There can be acute gastritis, can be gallstones, which can lead to dyspepsia-like symptoms. There can be various gallstones. There are motility disorders, example esophageal spasm. There can be functional non-ulcer dyspepsia and irritable bowel syndrome. Okay. The other gastrointestinal disorders consist of pancreatic diseases, which includes the cancer or chronic pancreatitis. Hepatic disease consists of hepatitis or metastasis. There can be colonic carcinomas. There are systemic diseases, various systemic diseases which can lead to dyspepsia-like symptoms like renal failure or hypercalcemia. There are also various drugs, the drugs like non-steroid anti-inflammatory drug, NSAIDs. There can be iron or potassium supplements, excessive use of corticosteroids or digoxin. So these drugs can also, if a person is taking any of these drugs like NSAIDs, iron or potassium supplements, corticosteroids or digoxin, this can lead to dyspepsia. There are other causes of dyspepsia like alcohol intake or psychological causes can also be there like anxiety and depression, which can lead to the development of dyspepsia. Now, what are the various alarming features that if present you should be cautious of? Yes, there can be a major abnormal pathology that can be involved in such cases. So if there is excessive weight loss with dyspepsia, then you should get alarmed. If there is any kind of anemia, if there is vomiting, or if there is any kind of hematemesis or melena, the dysphagia, if the patient is having dysphagia along with dyspepsia, then it is an alarming feature. And if there is palpable abdominal mass, then that also becomes an alarming feature. There are, this is the flow chart of dyspepsia. Let us understand what is to be done. This is the investigation part, and also contains some of management. So, if there is uninvestigated dyspepsia, if a patient comes to you, then there are three possibilities. You can test and treat. It works best if high background and rate of H. So just test and treat the patient. If it fails, then you have to go for endoscopy. Other approach is empirical PPI, proton pump inhibitors, that can be due to acidity. So if a patient of dyspepsia comes to you and you are giving him proton pump inhibitors, if that works best, and but if it fails, if it works, then it means then there are some reflex type of symptoms present in the patient. But it fails, you have to go for endoscopy. If the endoscopy is positive, then it can be organic dyspepsia. But if the endoscopy is negative, then it can be a functional dyspepsia, okay, without any cause that could be found out. So the options like diet, prokinetics, neuromodulators, and antidepressants. There are various non-pharmacological approaches which are used, and it is driven by the symptoms. Like if there is pain, then you can give an tricyclic antidepressant. If there is nausea with patient, you can give antiepileptics. And if there is early satiety or post-prandial fullness, then you can give persiflor. So this was all about dyspepsia. Now we will start with vomiting. So what is vomiting and what are the different causes of vomiting? Right. So let's start. Vomiting is a complex reflex that involves both the autonomic and somatic neural pathways. So what is vomiting? Vomiting is a complex reflex that involves both the autonomic and somatic neural pathways. It is a synchronous contraction of the diaphragm, the intercostal muscles, and the abdominal muscles. So there is synchronous contraction of these muscles, diaphragm muscles, intercostal muscles, and abdominal muscles. It raises the intra-abdominal pressure and combined with the relaxation of the lower esophageal sphincter that results in the forcible ejection of gastric contents. So there is synchronous contraction of the diaphragm. Why vomiting is happening? Vomiting is happening due to the synchronous altogether the contraction of the diaphragm, the intercostal muscles, and the abdominal muscles, which raises the intra-abdominal pressure. So in combination with the relaxed lower esophageal sphincter, it results in the forcible expulsion of the gastric contents throughout the intestine. Now, what are the different causes of vomiting? Vomiting can occur due to excessive alcohol consumption. If the patient is taking excess of alcohol, it can cause vomiting. It can be psychogenic. And there are various CNS disorders which can lead to the development of vomiting, like there can be vestibular neuronitis. Migraine can also cause vomiting, and raised intracranial pressure. This is also an important symptom for cause for vomiting. Meningitis can also induce vomiting. There are various gastrointestinal causes that cause vomiting, like peptic ulcer diseases, various peptic ulcer diseases. Can be the gastric ulcer and duodenal ulcer. There can be gastric carcinoma or gastroparesis can be there. Vomiting can also be due to uremia. There can be various causes which are related to the acute abdomen which causes vomiting, like appendicitis. It can be due to polycystitis. There can be pancreatitis, and intestinal obstruction can be the cause for vomiting. Vomiting can also be caused due to the intake of drugs, as we have discussed in the dyspepsia. Vomiting can also cause due to the drug ingestion, like NSAIDs, non-steroid anti-inflammatory drugs. Opiates can also cause vomiting. There is digoxin, antibiotics. If a patient is taking excessive of antibiotics, then it can cause vomiting. There are various cytokinase drugs containing cytokinase which can also induce vomiting. Vomiting is also seen in various infectious diseases like hepatitis, in the gastroenteritis, urinary tract infections. In all these conditions, also we will find symptoms of vomiting, as we have already discussed. So this was all about dyspepsia and vomiting. In the next lecture, we will be discussing about GI bleeding. That will include both the upper GI bleeding and the lower gastrointestinal tract bleeding. So this session was powered by JAYPUR version 2.0 JAYOTI VIDYAPEETH University. I hope you are satisfied with the digital session. If you have any query, please mention in the comment box. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow with a new topic about which I have already discussed, told you that GI bleeding, both upper and lower GI tract. Don't think that I have not mentioned about the management part, because I have discussed you the different clinical condition in which these symptoms are present. So the management part will be depending on the clinical condition in which these symptoms are present. Alright, so this was all for today. We will meet in the next lecture.